Good day, students. Let us discuss fundamental concepts of community health nursing that will guide your understanding as future professional nurses. This is critical because in our country, where health disparities persist, community based nursing is vital in delivering accessible and equitable care. Through community health nursing, we become advocates of public health and partners in health development. Community health nursing is an integration of two fields, nursing and public health. This integration means that community health nurses are not only concerned with individual care, but also with promoting and preserving the health of the families, specific population groups, and the entire community. In the Philippines, this can be seen in activities like barangay-based immunization drives or nutrition programs for children. In here, we act not only as caregivers but as public health practitioners working to improve community-wide outcomes. In CHN, we focus on prevention, health promotion, and community empowerment. This could be seen in barangay health centers, where nurses deliver services ranging from immunizations to maternal health counseling. By addressing community needs, CHN helps in the broader goal of national health improvement. Community health nursing is a population-focused nursing specialty aimed at improving health of communities. This means that we are concerned with the health status of communities as a whole and not just individual patients. We blend nursing theory with the science of public health to understand how factors such as poverty, education, environment, and culture influence health. For example, when we help design an anti-dengue campaign in a flood-prone barangay, we apply epidemiological knowledge and nursing principles to reduce community risk. This is much broader than traditional bedside care. We learn to view health problems through a population health lens, addressing upstream factors to prevent illness and promote wellness at the community level. What is health? The World Health Organization, or WHO, defines health as a state of complete physical, mental, and social well-being, not merely the absence of disease. In community health nursing, we adopt this holistic approach to health. In practical terms, this means that community health nurses do not only focus on treating illnesses like pneumonia or hypertension. We also address mental health, nutrition, housing conditions, safe water access, and even employment, because all these factors affect health outcomes. For example, when working in a GIDA community or geographically isolated and disadvantaged area, consider their local beliefs. We have many GIDA communities in Mindanao, such that a CHN must consider local health beliefs about illness, availability of clean water, and nutrition levels, not just symptoms of disease. This is what holistic care looks like in the field. Two core elements of community health nursing are prevention and health promotion. Our goal is not to wait until people become sick, but rather to keep them healthy through preventive measures and health education. For instance, primary prevention may involve organizing a deworming program in elementary schools. Secondary prevention may include conducting blood pressure screenings for adults in the barangay. Tertiary prevention could involve helping stroke survivors regain independence through rehabilitation programs. Community health nurses focus on care that targets not just individuals but families, and also groups and the entire communities. For example, a nurse working with mothers' classes may educate on breastfeeding practices, while at the same time partnering with local leaders to promote environmental sanitation for the whole barangay. Now, what is community and or public health nursing? Maurer and Smith define community health nursing as the synthesis of nursing practice and public health practice. This definition captures the dual role of a community health nurse, which is caring for individuals while also working to improve population health. The primary focus is on health promotion and disease prevention, the core values of the Philippine public health system. For example, nurses involved in the Department of Health programs, such as the expanded program on immunization, are applying community health nursing principles by helping to prevent communicable diseases. Similarly, those leading barangay wellness fairs to promote nutrition, physical activity, and screening for non-communicable diseases are engaging in health promotion, which is also a key function of community health nursing. The American Nurses Association, or ANA, further expands the definition, emphasizing that CHN uses knowledge from nursing, social sciences, and public health to promote and protect population health. This interdisciplinary approach is very important in the Philippine setting, where poverty, education, housing, and social norms all contribute to health outcomes. For instance, during an outbreak, community health nurses work with barangay officials, teachers, and social workers to deliver risk communication, contact tracing, and vaccination campaigns. Such collaborative approaches reflect the ANA definition in action. It is important to distinguish public health nursing or PHN from community health nursing or CHN. PHN is often government based. For example, nurses working at the municipal health office or the city health office or the Department of Health regional offices. They focus on population wide programs coordinated through government systems. Community health nursing, however, is broader. It also includes nurses working for non government organizations such as the Philippine Red Cross or faith based organizations running mobile clinics. For example, after Typhoon Yolanda, many community health nurses worked with NGOs to provide palliative care, mental health services, and child nutrition interventions. These activities were community based but outside the formal government PHN structure. The goals of CHN are very empowering. First, to promote self-care and independence. We want individuals and families to take charge of their health. An example is teaching mothers in mothers' classes how to properly prepare oral rehydration solution or ORS at home. Second, to support health equity and reduce disparities. In our country, marginalized populations such as indigenous people groups, urban poor, and those in GDAS require focused effort to achieve equitable health outcomes. Nurses working with these groups help reduce gaps in health care. The third goal of CHN is to enhance quality of life for individuals and communities. This goes beyond disease treatment. This includes supporting mental health, social inclusion, and environmental sustainability. For example, promoting livelihood programs alongside health education can greatly improve quality of life in impoverished barangays. Community health nursing has a broad scope. We provide care to individuals, families, groups, and entire populations. For your community health nursing one, we focus our care to individuals and families. During your community health nursing 2, we expand from individuals, families, to groups or population groups and the entire community. The services we provide include health promotion, disease prevention, rehabilitation, and palliative care. Our work settings are highly varied. CHNs may be conducting blood pressure checks at a local mall wellness fair, leading nutrition classes at a barangay health center, or providing home-based palliative care and health teaching for patients in the home. In rural areas, CHNs may deliver prenatal care through barangay outreach visits, while in urban settings, they may help conduct mental health screenings in schools and public places. This flexibility is what makes CHN both challenging and deeply rewarding. CHN involves all levels of prevention. Our focus is mostly primary prevention, which seeks to prevent disease before it occurs, which is through immunization or health education about specific health problems. Secondary prevention focuses on early detection. This is conducted through health screenings to catch a disease at the earliest possible stage. Tertiary prevention involves minimizing complications from existing diseases. For example, facilitating stroke rehabilitation groups or support programs for hypertensive clients. A good CHN practice will integrate all three levels depending on community health needs. Rehabilitation is a vital part of CHN. In here, we help clients regain function and independence after illness or injury. In the Philippines, CHNs may coordinate with rehabilitation centers or link families with physical therapy or occupational therapy services as provided by the local government units or their partner NGOs. We also assist with community re-entry. For example, we help stroke survivors regain social roles and independence. Our work ensures that functional recovery is supported beyond the hospital setting. In community health nursing, we also deliver palliative care. This is providing comfort and dignity for patients with terminal illnesses. CHNs often deliver home-based palliative care in settings where hospital-based hospice services are limited. We also provide family counseling, helping caregivers cope with emotional and practical challenges. In rural provinces, palliative care is a key CHN role because many families choose to care for terminally ill loved ones at home. Community health nurses are also advocates and policy influencers. We help craft barangay health plans and contribute input to city or municipal health boards. We also advocate for equitable access. For example, we work to ensure that remote barangays receive maternal health services or that indigenous peoples can access culturally appropriate care. We also address social determinants of health, such as promoting safe water, adequate housing, and nutritious food, which are all key elements to good health. Lastly, community health nurses promote community empowerment. We facilitate health planning that involves the community. For example, through barangay health committees or participatory action research. We help strengthen local organizations such as mothers' clubs, youth health advocates, and PW groups. And we support community-driven initiatives, ensuring that health programs are owned and sustained by the people themselves. Empowered communities are healthier communities. As we conclude this topic, let us revisit the key points that define community health nursing or CHN. First, CHN is a discipline that integrates nursing and public health with the goal of improving population health. It brings together the compassion and care of nursing with the population-level strategies of public health. As community health nurses, we will address not only individual health needs, but also broader determinants of health that affect the entire community. Second, the scope of CHN is both wide and dynamic. It spans health promotion, such as leading health education programs, disease prevention, which could also include vaccinations and screenings, rehabilitation, which is supporting clients in regaining function, and palliative care, providing comfort and dignity to those facing terminal illness. These areas of practice allow nurses to meet diverse health needs across various settings, from urban centers to remote barangays. Lastly, CHN always emphasizes care that is holistic, equitable, and community-centered. We strive to address the physical, mental, emotional, social, and spiritual dimensions of health. We also focus on reducing health disparities and promoting equity, ensuring that underserved populations such as the IPs, the rural poor, and informal settlers receive the care and services they deserve. Most importantly, we practice with and alongside communities, fostering empowerment and sustainable change. In essence, community health nursing offers us the opportunity to be not only provider of care, but also advocates, educators, and leaders in building a healthier Philippines.